Hey everybody, I'm Dr. Gaffney from Dr. Gaffney Best Foot, here today to share my tips and tricks from my 29 years of experience as a podiatrist to help you get your best foot forward. Today we're going to talk about the ugly truth of fungal toenails. Just as a reminder, this YouTube video does not constitute medical advice. It's for informational purposes only. This YouTube video is not the substitute for medical advice. It does not constitute a doctor-patient relationship. Please consult your doctor for any condition or treatment before you start. This video is not intended to diagnose, treat, or prevent any disease, disorder, or condition. Today we're going to talk about the ugly truth of fungal toenails. It's a very common problem. I did another video detailing the treatment and how to test for it and how it's caused. So please refer back to that. This is more of a shortened version. And the number one thing about this is it's extremely common, very easy to get. You get it from a trauma, and it's extremely difficult to get rid of. So please don't waste your money on any quick fixes that you find on the internet because they do not work. Over-the-counter antifungal topicals do not work. Please don't waste your money on that. And I know people do spend a lot of money trying to get rid of fungal toenails because they are ugly. So even prescription topicals do not work that well. In fact, they only work for toenails that have a little bit of fungus at the end of the toenail. And even then, the success rate's rather low. It's like around 20% or less. And also, it takes a lot of diligence for a long period of time to treat it with a prescription topical. So it's a 48-week, almost 1 year duration that you have to keep putting the topical antifungal on it. Now, we only have about 3 to 4 oral medications that can treat whole length toenail fungus, and the one that's primarily used is oral lamisil. The other medications don't seem to work as well as the oral lamisil, and even that prescription only has like a 38 to 76% success rate, and that's in the scientific literature. The recurrence rate ranges from 10 to 53% in the scientific literature as well. The treatment course for the oral antifungals is 12 weeks, so it's 3 months, but at the end of the 3 months, you don't have a clear nail. It knocks it out of the nail root and the nail bed during those 12 weeks. So the nail root, where the nail grows, then starts to produce healthy nails. So it's a gradual growing out, and it can take up to a year after you're done with the 12 weeks for it to grow out. So during that time, you still have fungus out at the end of your toenail, and it can reinfect back in the nail root and cause the whole thing again. So it's quite tenuous. The other thing about the oral antifungal treatment is that it's risky. You have to get liver function studies. When you take the medication, there's a rare chance of liver failure, and also there's drug interactions. But it's relatively safe for the right patient who has a healthy liver. And most people can take it safely, but you have to work with your doctor. So in summary, we don't have many good, reliable treatments that are long-lasting for the toenail fungus. So the best treatment, in my opinion, is prevention. So we're going to go through 7 ways to prevent onychomycosis. So number 1, keep your nails trimmed. So usually I tell people just cut your nails straight across, a white line, tiny white line at the top. When they get too long, like past your toenail pulp there, you can catch your nails on socks and bedding and clothes, and you create little micro traumas, and the trauma is what lets the little fungal organism, microscopic fungal organism, get into your nail bed and set up shop. Also, number 2, do not let your toenail polish on for too long. So fungus takes 24 to 48 hours to start to grow in a favorable environment, and it's extremely favorable when you have a dark, moist place, like underneath a layer of toenail polish. So I would say no longer than 2 days with the toenail polish, or you could try to find an antifungal toenail polish like through Amazon. Okay, number 3, do not push back your cuticle on your toenail. Do not forcibly clean around the nail, and especially down there at the base. That's where you can cause microtraumas, let that microscopic fungus get in there. So that means just be careful when you get your pedicure that they don't get over aggressive in those areas. Number 4, after minor toenail trauma, I would recommend using maybe a tea tree oil on it to possibly kill any fungus that might be around in the area. So tea tree oil has had some antifungal properties in some scientific studies. It's not really used to treat toenail fungus, but myself personally, I use that if I have a trauma. I just put the tea tree oil on there and kill any fungus that might be hanging around so it doesn't set up shop. And I would probably do that once a day for 2 weeks. And then if you notice anything happening like thickness, yellow, crumbly debris there, I'd go to your doctor as soon as you can and get a prescription topical to kind of treat it before it gets out of hand, because it'll slowly take over the whole nail and get back to the base before you know it. The other thing with this minor toenail trauma, even like if you go to your doctor, your podiatrist, and you have an ingrown nail and they take out that whole side there, that's a toenail trauma, and it actually exposes the nail root. So a lot of times I would tell my patients to put the tea tree oil with their antibacterial ointment when they do their wound care, so you don't get a fungal toenail. And number 5, let your feet see the sun as much as safely as possible. So wearing sandals, the UV light will kill the fungus. But it's kind of a double-edged sword, because then you could more easily traumatize your toenails and lets the fungus get in there too. So probably the best thing is just sitting by the pool and just relaxing. And number 6 is if your feet sweat a lot, you should probably put your shoes out in the sun, the shoe liner, and let the UV light kind of kill the fungus inside the shoe, or maybe get a shoe sanitizer. They do sell them at Petafix and Amazon, and it'll kind of kill the organisms in there, or even just Lysol your shoes. But yeah, you can put your shoes out in the sun, let it kill the fungus in there. Also, if your feet sweat a lot, now the sweaty environment creates that moist environment that fungus likes. So if you do sweat a lot, you're just having an increased risk of getting toenail fungus or athlete's foot. So for sweaty feet, I recommend an underarm antiperspirant on your foot. So just whatever you use in the underarm, just do it on your feet too, and that'll help some with sweating. There's some prescription antiperspirants that you can get from your doctor. Or the one I like to use is called Dry Sol. Okay, number 7, if you have an athlete's foot, treat it, because that serves as a reservoir for fungus for the toenails. So the treatment that I like to use is the topical lamisil. Topical lamisil over the counter works very well for athlete's foot. It doesn't treat the topical anyway, doesn't treat the toenail fungus, but athlete's foot is much easier to treat with topicals. So any over-the-counter topical, if you use it as instructed, should get rid of the athlete's foot within like 2 weeks. Athlete's foot is similar risk factors as the toenail fungus, and it will tend to recur, so you probably need to have that on hand to treat as needed. Okay, so that is all I have for you. And like I said, after you take the 12 weeks of or on a fungal, I would use your prescription topical until the nail grows out clear, and also follow those points of prevention. And I hope this helps y'all, and thank you very much for watching, and like and subscribe.